ये वो
हाँ, कोई अभी तो कुछ इशू नहीं आया, वो स्क्रीन चली
सेव
गई।
हुआ ना पर
हाँ, सेव होके वो चला गया, वो स्क्रीन इज
हाँ
नॉट।
तो हो गया फिर मैम के चैनल पे चेक कर लेता
ओके, सो लेट मी टॉक टू हर। Good evening, Dr. Sunita. Diksha this side from MediSage. Welcome to the session. I hope I am audible to you, ma'am.
हेलो दीक्षा मैम
Dr. Sunita
Yeah.
will be joining in 5 minutes. Just
Yes, Akash.
मैम के यूट्यूब चैनल पे लाइव हो गया
हो गया?
दिख रहा है हाँ
Okay, done.
बस ये
Thank you.
3 स्टेप ही करना था
Sorry?
ये 3 स्टेप ही करना था बस
Okay, okay. Got it.
आपको समझा ना कैसे करना
Yes, got it, got it.
ओके मैम
So
तो
we
मैं
have
लीव कर
6
रहा
minutes to live. हाँ, you can leave. Thank you.
हूँ वेलकम मैम
Yeah. Hello, Dr. Sunita. You're on mute. Hello, ma'am. Good evening.
Hi, good evening. Am I audible?
Yes, ma'am. Now you're audible. So Dr. Ritu will be joining from the clinic. She's in clinic only.
Okay.
Yeah, just waiting for her. So meanwhile, ma'am, would you like to just share your screen for the slides?
No, I'm not prepared. It's not slide. It's basically one-to-one talk show.
Okay, okay, okay.
Okay. I think she will be asking questions and I will be
Yes,
answering.
yes, yes.
Okay.
Okay, so Dr. Ritu is also here. I'll just admit her. Good evening, Dr. Ritu.
Yeah, hi. हाँ
Hello,
सुनीता,
ma'am.
गुड इवनिंग।
Hi, hi. कैसी हो?
ठीक हूँ मैम, आप कैसे हो? हाँ
मैं ठीक हूँ, एकदम बढ़िया.
हाँ ओनली मैम 2 minutes we will
Yes, yes, sure, sure, sure.
ओके बोलो ना
Ma'am, we are live on YouTube. Could you please check your YouTube?
अभी
फ्लूइड खिला दो एक।
Dr. Sunita, we will be running this event live on MediSage, which is a doctor's platform. And as far as gynecology community is concerned, we have around 50,000 gynecologists who are associated with us. So it's a very huge platform with around 8.4 lakh doctors with all the specializations.
Coming live on the YouTube. Yeah. Coming.
Yeah, great.
हाँ.
So shall we start, ma'am?
हाँ हाँ करो ना start करो. हाँ हाँ.
Great. So we are live now. Good evening, everyone. I am Diksha Gambhir from MediSage E-Learning Private Limited, a leading platform dedicated to empowering medical professionals through knowledge sharing, expert insights, and digital innovation. And today I welcome you all to yet an insightful Medtalk on multiple IVF failures. So we are honored to welcome two stalwarts in women's healthcare today, Dr. Ritu Santwani and Dr. Sunita Chandra. So Dr. Ritu Santwani is a leading obstetrician, gynecologist, infertility specialist, and sexologist with the prestigious credentials MBBS, MD, FICOG, FIAOG, and ART Singapore. She is the founder and CEO of 360-degree Healthcare Studio, NUHS Singapore, a global advocate for women's wellness. She is recognized among the top 50 influential doctors on social media and serves as co-founder of MAAM and board member of SWWC. Welcome, Dr. Ritu.
Thank you, Diksha. Thank you so much. हाँ.
Yeah, thank you, ma'am. So joining her is Dr. Sunita Chandra, Director of Rajendra Nagar Hospital and Sunita IVF and Fertility Center, with over 30 years of pioneering work in IVF and reproductive health. She has held key leadership roles in IFS and APGL Lucknow and is widely awarded, including the IFS Achiever Award 2023 and Nari Shri Samman 2024. Her expertise spans PCOS, IVF, IC, SI, laparoscopy, and high-risk pregnancies. So we are truly privileged to have them with us today. And now I would request Dr. Ritu to take it forward from here. So Dr. Ritu, over to you.
Yeah, thank you, Diksha, and warm welcome to everyone, each and everyone, the doctors who have joined all across the globe, and very warm welcome to Sunita ma'am. Sunita ma'am, really we are grateful to you that in spite of the busy schedule you have taken out time. Sunita ma'am के talk हमेशा ही बहुत informative होते हैं. So whenever I approach madam for any of my show, madam is always ready to support us. So thank you, madam, once again. So today, the topic which we are going to discuss, I think everyone has a lot of queries related to that, related to multiple IVF failure. So what are the causes? How can we treat? What is the role of the lifestyle? Related to this, what are the new tests have come and how can we use the more new technologies? To discuss all about that, we are having Sunita ma'am with us. So ma'am, with your permission, shall I start with the questions?
Yes, sure.
Thank you, ma'am. So first, my first question comes to like this, that when we say that what counts as a multiple IVF failures?
So Dr. Ritu, actually the topic is really very good, multiple IVF failures. But if you see, there is no definition for multiple IVF failure as of now. It's like multiple implantation failure, or we can call it recurrent implantation failure. So whenever we do a cycle 1, 2, 3 and the patient is not conceiving, we can call it as multiple IVF failures. So if the patient is under 40 and more than 3 good embryos have been transferred to her and she has still not achieved pregnancy, whether in 2 cycles or 3 cycles, then it is recurrent implantation failure, or we can call it multiple IVF failures.
Thank you so much, ma'am. So, ma'am, when can we say that what are the common causes what we are seeing for this multiple IVF failure?
So I feel there is a seed and there is a soil. So there has to be something between these two only. So seed is prepared with X and Y. That means X and sperm. So let's talk about X. If the X number is very less, the quality of X are poor, or the lady is around 40, 36, 37, I mean more than 35, her AMH is very low, then definitely we are going to get a very poor quality of X, poor number of embryos, and poor quality of embryos. Then second comes on the semen. Yes, if the semen is poor, count is bad, it doesn't matter much, but the motility is poor, morphology is very, very poor. And if there is a high DFI, then these things also count. So the sperm, the egg, and the embryo, this is one thing. Now, second thing is you have prepared a very good embryo, grade 1, but the endometrium, that is the uterus lining, is not good. Then also it will not be a good pregnancy. It will be an implantation failure. Besides this, there are some lifestyle factors. Then there are some hidden medical causes which the patient is suffering and we don't know about it. Besides all this, there are certain causes we still don't know that why there is so much of implantation failure. When there was a good embryo, when there was good endometrium, the timing was good, the transfer was very, very good. Still, we have given a very good luteal phase support. Still, the patient has not conceived. So these are few causes which we can actually see. Otherwise, there are multiple things even today we don't know about it.
Very true, ma'am. So, ma'am, as the patients these days, all the patients are very much tech savvy. First of all, they search all the things in the Google, and after that, they are approaching to us saying that, ma'am, we have read this, we have read this. So you think that these are, because अगर हम वो सारे ही टेस्ट करने लगेंगे, तो I think the IVF which is coming 1.52 lakh will go in 7-8 lakhs. So my because these days a lot of patients are asking about the immunological causes. So ma'am, what do you think? क्योंकि आजकल सोशल मीडिया पे भी रील्स इतने आ रहे हैं immunological causes of the IVF failure. So I want today you are here so we can discuss something about it. You think it is very important to do the testing for the immunological causes?
So, okay. So it's like genetic testing. Hai na? So even if you do a karyotyping husband and wife, it doesn't, both of us know that it doesn't serve much. Okay. Unless we do a proper NGS like gene sequencing, we really don't know the cause of infertility. So nowadays people are doing even HLA testing, HLA matching karne lage hain. Yes. Then immunological causes, if we see, the lit therapy is very, very popular nowadays.
Yeah.
But Ritu, do you think that immunological causes really play an important role in implantation failure?
No, ma'am. No, I don't think so. Huh.
Yes.
Because I think this is all a hype has made these
yes.
days.
And you are actually increasing the cost of IVF. You are actually not increasing the pregnancy rate. Bulky, what are you doing is you are just increasing the cost. Reading everything on the Google, reading everything on media is not true. Like, I will not name the molecule, but there is one molecule nowadays, it is being used very, very frequently by some of our colleagues from when they are doing embryo transfer from day 1, 3, 5, 7, and they are using almost 45,000 injections without any benefit. So what I follow is, I follow all ASHRAE guidelines. If they say no, it is useless, I will say it is useless. If they say yes, it is good, I'll do that. So it should be, I mean, thoda sa evidence-based medicine practice kare to zyada sahi rehta hai.
Very true, very true. Thank you so much, ma'am. Ma'am, coming to the another query, as once the lot of doctors, junior doctors also ask us that, madam, if the patient of the multiple IVF failure is approaching to you, so is it something like that you want to suggest some additional nutraceuticals or some dietary changes? So please enlighten us about that.
So that is actually very, very favorite to me. So I definitely tell them, for female, I'll tell them, do some yoga, do some meditation, take some supplements like zinc, magnesium, calcium, vitamin D, CoQ10, take all these supplements and natural things. I'll tell them take high fiber diet, take fruits in your diet, take some seeds, take some nuts, take proper sleep. If you are stressed at work, try to reduce that stress. If you are heavily worked, you are working almost 15, 16 hours a day, try to reduce your working hours. Try to have a, harmony between you and your husband and your family. So this is, and if your weight is more, try to reduce it. If your weight is very less, try to gain a little bit. Do some exercises every day, whatever it is. Then come to the male partner. If he is obese, he has to also lose some weight so that the sperm quality is good. Smoking, I don't say stop it. I just say decrease your number of cigarettes. If you are smoking 6, do it 3, do it 2. Alcohol intake definitely has to be stopped or at least cut down. And if this isn't both, even in females and males, alcohol is one thing which actually takes very good sperms and eggs from your body. This actually directly affects the quality of the eggs and sperms, and then the quality of embryo, and then implantation failure, and then pregnancy rates. So alcohol is very, very important. Again, I tell them when you start your cycle or when you start your pregnancy planning, at least 1.5 months before you should stop drinking, you should stop taking alcohol. And same thing goes with smoking, but that actually if a male or female, they are doing regularly, they will not stop it. So we can just tell them you have to regulate your smoking pattern. Weight, smoking, stress levels, and alcohol, and some meditation, yoga, and very healthy diet, not junk food all the time.
Dr. Ritu, you're on mute.
Yeah. So, yeah, thank you, ma'am, for that. Ma'am, related to, as you have very rightly emphasized about this, the smoking, alcohol, gutka, these all are the very, very common things we are seeing these days. And my next question comes to you, as a lot of nutraceuticals also we are adding in the cases of the multiple IVF failure. So you think I asked about the sum as the role of the arginine, because we are giving the specifically the target oriented what are needed. But these days, lot are coming. Some are coming with the melatonin, some are coming with this coenzyme Q10. And besides this, also a lot of nutraceuticals has come in the market. And so what do you think, ma'am? Lactium is also come, because yesterday only the one patient was asking me, ma'am, I have heard somewhere that adding the lactium is very good for the multiple IVF failure. So what's your opinion?
So there are combination of some amino acids like leucine, L-arginine, aspartame, I don't know what all. What I feel is a proper multivitamin, then some calcium, vitamin D is must. Folic acid, obviously, we are giving to everyone. I actually in favor of CoQ10, because CoQ is one thing which acts on mitochondrial level, and then it is actually going to affect egg quality and sperm quality both. So if in any form or in combination, we can give CoQ to these patients, male and female both, it can be given, but not all the nutraceuticals. अभी अजी आया curcumin आप देके देखिए, then फिर जैसे तुमने बोला लेक्टियम देके देखिए, मेलेटोनिन देके, सब nonsense, ठीक है? So I mean, if they are taking it, it's okay, but every nutraceutical is not going to affect your pregnancy rate.
Correct. Diksha, you can take some questions. We are receiving online some questions. You can take, Diksha.
Yeah, sure. So the first question that has come is, ma'am, what is your approach to assessing endometrial receptivity in patients with recurrent implantation failure?
Yes. So actually, endometrium is very, very important, and that may be a very important cause of repeated IVF failures. Okay. So we all assessed it, although it has been said that even you can get pregnancy even at 4.5 millimeter thickness endometrium if it is trilaminar. But for actual pregnancy, we need minimum of 7 mm trilaminar endometrium. And there is a recent paper, as the endometrial thickness increases, the pregnancy rate increases from 35 to 45% up to 10 mm. But after 10, it actually doesn't matter if it is 11 or 12. But till 10, yes, it gives you very good results. So if it is a thin endometrium, we have to work on it. And nowadays, I feel there are 3-4 things. One, of course, is lifestyle modification. Second, hysteroscopy is must. If the patient is getting continuously thin endometrium, hysteroscopy should be done to assess the uterine cavity. And usually you find the cause, and that is typically chronic endometritis, or there may be subsymptom, or there may be a polyp, or there may be some adhesions. Chronic endometritis is one of the important cause of thin endometrium. And especially in our place, I mean, this area, tuberculosis of endometrium is again very, very common, and that is tubercular endometritis. To improve thin endometrium, obviously you are giving estrogen orally, which can be given locally also, local applications. Vaginal applications sometimes gives very good result. And PRP. GCSF is now back foot. PRP definitely gives you good results in thin endometriums. Especially the latest regime, day 7, day 9, day 11, day 13, we start PRP installation, intrauterine installation from day 7, then day 9, then day 11, and day 13, and then we see the endometrium.
Okay, great, ma'am. So now Dr. Savita is asking us, what are physical and psychological problems a woman faces on IVF implantation failures?
So this is very, very important. Dr. Savita, thank you so much. You have touched my heart, because whenever you see a patient coming with negative results, especially first, second, third, whatever, they come crying with you. Why? Why do they come? Because some people are emotionally exhausted and some are financially exhausted. So first thing, you have to be empathetic with them and let them cry. Let them come out with their grief. It is their grief. Let them show it. And don't be judgmental. In sabke baat, tell them there is still a hope. We can change the protocol. We can just give you a time of 3 to 4 months, 3 to 4 menstrual cycles to go, and then you can come again. We can change the protocol. We can change the gonadotropins. We can actually, if the eggs are bad, we can take donor egg. We can take donor sperms. We can take donor embryos. And if nothing is working, then third party reproduction can be done. But initially, what is our role is that we have to listen to them. We means me, my counselor, my team, all of us have to be very, very empathetic to them.
Exactly. So, ma'am, moving on to the next question, that is, what basic tests should patients expect after 2 failed IVF cycles?
So as I said, one is like basic test. If I talk, so we already do CBC, urea creatine, LFT. So I'm not talking about that. But basic is thyroid test, anti-TPO antibodies. This is must. Then APLA profile, anti-phospholipid antibodies, anti-nuclear antibodies, then beta-2 glycoprotein, and this lipase anticoagulant. And sometimes even MTHFR variant is very, very important. Then we can go for, most important is hysteroscopy, to look into the endometrium. If we feel that embryo was very, very good and still there was no implantation, then this is a time to go for hysteroscopy. Sometimes there are hydrosalpinx which are being neglected. So even laparoscopy may be required for that.
Okay, thank you, ma'am. So moving on to the next question, are there any specific considerations in tailoring IVF cycles for women with autoimmune disorders or thrombophilia?
Yeah, so when we tailor these IVF cycles for these patients, we have to start something like blood thinners. So we can start with ecosprin, 75 or even 150 per day. Then in the luteal phase, we can start low molecular weight heparin, 40 units per day, maybe sometimes even more. And a short course of steroids also works for them. And if they are a, established case of autoimmune disorder, then even SCQ. If the patient is on SCQ, then SCQ 200 milligram PD or OD can be given. So 3-4 things. One is ecosprin, another is low molecular weight heparin, and third is SCQ, which are good for these patients.
Okay. Thank you, ma'am. So moving on to the next question, that is, how do male factors, including DNA fragmentation, contribute to repeated IVF failures despite normal semen parameters?
So, Diksha, if you ask me, Ashri says that DFI doesn't play any role in recurrent implantation failure. So,
Okay.
this is just a test which should be, taken out from our battery of the test. DFI is not at all important. You just give them some antioxidants for some time, 15 days, 20 days, maybe a month, and that will take care of all the problems of sperms. So, if I say that recurrent implantation failure is because of DFI, increased DFI. No, it is not true because there is no evidence about this.
Okay. Ma'am, before moving on to the next question, Dr. Ritu, do you have some questions or anything from your side?
Yeah, just now, ma'am, I have received one question. This is from Dr. Radha Mishra. She has joined all the way from Wardha. She has dropped me a message. Madam, both of you are discussing all the important points. My one important query, how to handle the patients with the multiple IVF failures who are financially exhausted? Please give us some.
वेरी राइट सी यदि आप मेरे से पर्सनल बात करें डॉक्टर राधा आप बिल्कुल सही बोल रहे हैं मतलब अभी इसी हफ्ते भर के अंदर मैं बता रही हूँ आई डिड वन साइकिल फेल बट शी वाज रियली पुअर शी सेड डॉक्टर प्लीज डू समथिंग फॉर मी बिकॉज मेरा हस्बैंड तो मुझे घर से निकाल देगा believe me I did a second free cycle and she has conceived. She is having 7 weeks single pregnancy. I'm very very happy for her, very happy. Second patient I have to do for her. So this was again a very poor patient, thela lagati thi. I just charged 60,000 for a ICSI OD cycle, but she did not conceive. My bad luck, her bad luck. But I promised that yes, I will do a complete free cycle for you. So I think we also have to think about them. I know IVF is an expensive thing for us also because we have to buy so many machines. We have to keep up the labs updated, and then everything comes with a cost, whether it is embryologist, whether it is medicines, whether it is your lab, everything comes with a cost. But then somewhere sometime you have to think about them who are really really needy, who are financially exhausted, and they really want a bacha for their family, for saving their family. I mean, some in our society all of us know बच्चा नहीं है तो औरत को घर से ही बाहर निकाल देंगे because it is her fault only. हस्बैंड स्टमक भी होगा तब भी औरत को ही घर से बाहर निकालेंगे. So Dr. Radha, मतलब you have really touched my emotions on this because for last 30 years in Lucknow practicing infertility, I'm facing this day, night and day out, that it is really bad for them. So if we at all we can do something, we should do it.
Correct. Yeah, very true. Madam, my next question to you. As we all know, these days AI has come. So yes, AI in everything. So a lot of the recent, this is Diksha's favorite also. So
Exactly.
She always asks me question about the AI. So that's why I thought. So as we know, the time-lapse imaging, embryoscope, all have plays a very, very good role. So what do you think by including this AI techniques, how can we still improve the rates of the recurrent IVF failure?
See, so there was something like morphokinetics because morphologically we are grading the embryos, and then this came embryo lapse and time lapse, and then we were doing morphokinetics and we were seeing the growth rate and everything. And sometimes it was seen or it was in literature, in paper, that yes, embryoscope is increasing success rate. But Ritu, I think you will agree with me that Ashri has again proved that it has not increased pregnancy rate, it has just increased the cost of the cycle. So if you really want to see whether this embryo is good or not, then I said PGT. I mean, you do PGT-A for all the embryos, and if it is an aneuploid embryo, don't transfer. If it is euploid embryo, transfer. So that is about embryoscope or time-lapse technology. So it is like this maybe sometimes it is giving a few percentage of increase in pregnancy rate, sometimes not. So we cannot actually say that embryoscope is very, very good. Let's all buy it because again, everything comes with a cost. And if it is costing us, it is going to cost patient also. So, and if we want to make the cycle economical, we cannot afford it. Now, for other things like robotic ICSI, doing things and all that, और AI actually मुझे लगता है जो रितु तुम भी बताओ, मुझे लगता है कि एक जो डोजेस टाइट्रेट करने में एंड इनिशियली ओनली ये बताने में कि इस पेशेंट के सक्सेस रेट क्या है, आई थिंक उस एरिया में AI is going to help us. That is what I feel.
That's very correct, ma'am. But still, a lot of work is going on. अभी
Yes.
जैसे होने से
Yes.
revolution आया है, means at least for the new devices, what we are seeing, because yesterday only I attended one this online conference where I was a speaker for the Saudi countries. So there, the one doctor has presented a paper. They are this AI, they are started incorporating a lot of things. So as you have rightly mentioned, yes, for the dosage schedule also they are incorporating for
Yes.
this. So yes, of course, still the more work has to be done.
Yes.
But आगे तो हमें कुछ ना कुछ help जरूर मिलेगी इससे.
Yes, definitely. AI is coming in a big way in all the fields, not only in IVF, in all the fields. So let's see what happens, and then we'll incorporate in our armamentarium also, our labs also. But I think it's too early to say whether it is really going to help us or not. It's too early, but definitely it is coming. It is going to come in a big way.
Going to make a difference.
Yes,
Yeah.
yes, it will make a difference. Yeah.
So
So
we have some more questions that have come up, 2 of them. We'll quickly take them up before we wrap up. So when should patients consider advanced options like donor eggs or surrogacy?
So see, दो बिल्कुल अलग-अलग चीजें हैं. If I talk about donor eggs, if the patient is not responding at all, her AMH is very, very less, or she has good AMH but her eggs are very, very poor, then she should consider donor egg without wasting her money. If we talk about surrogacy, so if the patient is having some medical problem, she just cannot carry pregnancy, or her uterus is not allowing her for pregnancy. I mean, she is badly adenomyotic, she has multiple fibroids, or the hysterectomy has already been done for some or other reason, then this is the time to go for surrogacy.
Okay. Great. So the last question for the session that I would like both of you to give your insights on is, can a woman with PCOD and PCOS can be more prone to IVF failure? If yes, what are the measures that can be taken?
So Ritu.
yes, see, this is actually a very, very myth also, I can say. And abhi to we are using lot of protocols, lot of new techniques. Yes, we have to monitor properly. Yes, in the PCOS patients, instead of recurrent IVF failure, we can say we are more worried about the OHSS.
Yes.
So, अगर हम ovarian hyperstimulation control कर लेते हैं, then after that the freezing, and after I think we are giving the proper progesterone supplements, then usually the results are coming good. So we are more worried. Actually, I am very much scared about this OHSS. मेरे एक पेशेंट को तो इतना भयंकर हुआ था, means still अभी भी मैं याद करती हूँ ना, I only delivered her twins, but still आज भी मेरे रोंगटे.
So I would say one thing, for PCOS, 100% freeze all cycles.
Yes.
You have 0 OHSS. This is one. Second, plant only 1 embryos, 1 single blast. Twins, I mean, 2 blasts are not good for them, because sometimes even if we are implanting 1, they come with a twin that divides, because that's very good. So PCO does not equal with infertility. But yes, for IVF, we are very happy with PCO patients. We are not worried. Intake cycle, freeze all, transfer in the next cycle, transfer only single blast. Because PCO patients, if they have twins, they have multiple problems in pregnancy. So, I mean, we have to avoid 2 blast transfer in PCO patients.
Very correct. Ma'am, actually, that was my NRI patient. She came for a short duration to Pune.
Yes. And then you have to do, yes.
She told me only for 3 months. After that, I'm not going to come. और इतना कम AMH होने के बावजूद भी हमें मतलब by chance मिल गए. Sometimes after taking the everything, consent, permission, sometimes we have to do the practical and what are the theoretical guidelines.
I have 40-year patient with AMH of 1.2 went into VHSs.
Okay.
Okay.
Uh,
So you are very right. Anything can happen in medicine.
Yeah. So I think, madam, you have answered our all queries. So thank you so much. And we are pretty much on our time. Our show time is 8:30 to 9. So
Yeah.
thank you once again, madam, for sharing valuable thoughts with us. And thanks to MediSage and Diksha too for providing us the platform for such a knowledge sharing programs. So with this, we will wind off for today. Diksha, you can give the closing remark and we will wind off.
Yeah, definitely, ma'am. So thank you, Dr. Sunita and Dr. Ritu, for your insightful and clinically relevant session on a very important and intriguing topic, multiple IVF failures. Your expert perspectives have brought much needed clarity to this complex subject, enriching the understanding of many practicing clinicians. We deeply appreciate the time and expertise you have shared with the MediSage community today. To our viewers, thank you for joining us and thank you for asking so relevant questions today. And if you missed this important session today, you can tune into the past section of CMEs and rewatch as many times as you would like to. So stay tuned, stay informed, and stay empowered. Thank you everyone for joining in today. Good night and namaste.
Namaste. Before we will say good night, let us announce that on the 12th, we are having a session on the male infertility. So do log in at the same time at 8:30 p.m. Till then, bye-bye. Good night.
Bye-bye. Good night. Thank you.
Thank you.
Interesting.